So we have a CPL here in our office, and
so
okay. Yeah. So all of the labs that I can get through CPL, so a CBC and a cholesterol and thyroid and all that stuff, they'll just take your insurance card, and we let you submit that through your insurance. And since CPL's on everybody's insurance, 99% of the time that just gets covered at whatever your rate is. Usually, I mean, 100% usually, but. And then for all the other tests, they will physically, if it's a blood test, they will physically draw it for us in our office, and then they mail it off to the other lab. And those tests we have you pay out of pocket for, and then we give you all the codes at checkout, or we direct you to our website where they're listed, and then you can file for reimbursement. And Jen, the office manager, is happy to go over that with anybody before they even make an appointment, so they fully, understand we don't have any secrets. We want, people to be very comfortable with what's going on. I mean, what I tell people is, I would say at least 50% of my patients on the third visit I'm saying to them, this has been great. Sounds like you got what you needed out of it. Let us know if you need anything else. So it's not an ongoing thing. I mean, it's very typical that somebody comes for the first visit. We see them back in 6 weeks after they've done all their testing, and it can sometimes take a month for these labs to come back, and then 6 weeks for you to do the full elimination diet with adding the foods and whatnot back in. So then you follow up at your 6-week visit, and then usually at that visit, you're getting the advice about what foods to eat and what diet to follow at this point, and then what infections you have in your gut, and if your thyroid's off or whatever. And so at that visit, it's usually for treating parasites, and that's a 2-month-long treatment for this stuff. So I usually have people come back in about 10 weeks. And if it was something, allergies, irritable bowel, fatigue, depression, anxiety, some sort of average things, really at that third visit, where I'm saying to them, I will say at this next visit, if you're still feeling as good as you are, and I'm doing even more for you, at the next visit would probably be parting ways if you would like. So it's an investment of, it's a commitment on the patient's part to do. I don't have a magic pill. It's a commitment on their part, and it is an investment of some time and resources. But if you look at it from the standpoint of, the guy, literally I had 3 follow-up patients today, and 2 out of the 3, if not all 3 of them, I said that exact thing to. On the third visit, we might be parting ways unless you need something. And one of them's was an ulcerative colitis patient. He's off all his meds, feels fabulous. And so he's not paying for these meds monthly. He's not having to go to appointments. He's not missing work because he's having flares. So, I mean, you can't even quantify that in terms of a monetary thing. I mean, the number of people that I've had who've been unable to go to work literally had me writing disability letters for them and no longer having to do that. I mean, you can't put a price on your health, in my opinion, because if you don't have your health, you literally have nothing else. I mean, if you don't feel well enough to get out of bed, then really nothing else matters. So it can be an investment of time and resources, but that is very quickly achieved and very quickly, hopefully, resolved for people. Of course, I see tons of people with fibromyalgia and chronic fatigue and a lot of sort of very outside-the-box stuff that all is going to be great for them to get off gluten and dairy and fix their gut, but they might have heavy metals or mycotoxins from the environment that they're living in with mold. So, I mean, there are a lot of other very sophisticated things that I do, and I've experienced, all of this in my own life, which is something that I didn't really talk about in my story, which is, besides my autoimmune disease, I mean, after going through medical school and residency, I mean, I would just never forget this period. I was actually going to a functional medicine conference, and I'm in the airport, and it was like the Atlanta airport or some huge airport, and I went to the wrong gate. I went to like B instead of A, and these airports are just enormous, and I'm thinking, oh my God, I have to walk 20 gates. I mean, literally, it's like in my mind, I could go into tears right now. I'm thinking, I have to walk 20 gates. I don't think I can make it. Like, I just want to lie down right here and I can't walk 20 more gates. And so, I mean, I don't eat gluten, I don't eat dairy, I already said I don't really eat any grains. I had candida in my gut. I didn't have any parasites, which was amazing with all the world travel that I've done. I had high heavy metals because of my MTHFR gene. I've been exposed to toxic molds. I mean, you name it, I've sort of had it. And so, again, I just can speak from personal experience of there's very little that I'm going to be asking a patient to do, if anything, that I haven't personally experienced. So, I mean, not only do I have the benefit of seeing this working for people every day, I have the benefit of seeing it work in my own life, and that I do 100% practice what I preach. And that is something that I think everybody in the office can tell you, that I'm not over here telling you to do one thing and I'm doing something the complete opposite, short of my dark chocolate addiction, which is real, which is a real one. There's not a lot that I'm going to be saying to you to do that I don't do every day in my own life. So when people are coming and they're having these barriers, and how do I do this when I travel, and what do I do when I do that, I can speak from my own personal experience about what I do and how I overcome those, as well as obviously I get information back from other people about how they've handled it. And so I'm able to sort of talk to a patient about my own, what I do when I travel versus, I heard this great suggestion from another patient the other day and this is what they did when they travel. So you can really, I think patients feel like when they're here that they're really, it's not just somebody telling them to do something that they don't have firsthand knowledge of really doing themselves.